Things you can do to increase your milk supply: make sure you're well hydrated, lot of fluid intake. You should have a well balanced diet. Continue taking your supplements, especially iron supplements. Make sure you're well rested and relaxed. I know it's hard to do this with a newborn, but if you're tired, if you're sleepless, restless, or anxious, this can hamper your milk production. Try skin to skin contact, which is kangaroo care, that can get your hormones running and helps with your milk production. You can also try breast massages. Breast massages during a feed, before a feed, also helps with increasing your milk supply. Try demand feeding. Demand feeding means feeding the baby whenever the baby wants. So you should feed the baby 8 to 12 times a day normally, but some babies do something called as cluster feeding. They might want milk more frequently, so they can ask you every hour or even every 30 minutes. So try demand feeding, that is every time your baby wants, put your baby to the breast. Each time at least for 15 minutes. If you're using formula, try adequate latching and adequate suckling first directly on the breast, followed by which, if there's not enough breast milk, then you can give formula. Try to start with very minimal quantities of formula first. And even when you're giving formula, avoid using milk bottles with nipples. Try using milk bottles with spoons attached. If you give a milk bottle with a nipple, there is nipple confusion, and the baby may get used to the bottle's nipple and may not latch onto your nipple very well. Don't be apart from the baby. Spend more and more time with your baby. This also helps with the hormone let down reflexes, and offer both breasts to your baby in each feed. If there is inadequate milk from one breast, in the same feed you can switch over to the next breast. You can keep switching to and fro. Now immediately after feeding, if your baby is not full, pump immediately. Pump for 15 minutes. Whatever milk you've pumped, you should feed that to the baby also. If none of these are still working, you can try power pumping. As a last resort, you should meet a lactation consultant or a gynecologist. You might be put on some supplements like galactogogues, which increase milk supply, or you might even be needed to start on medications.